The CDC has released a new report which shows us the true number of COVID deaths. Today we are going to discuss what implications this should have on our country. And at the end of the video, being a football station, primarily a football station, at the end of the video we will discuss what implications this should have on fall football. But first, be sure to like this video, share this video on social media, and subscribe to this channel. I'm going to pull up several articles for you all today. The first one will be from ABC News, and I have to be honest with you, it was not easy to find. Of course, the media is being pretty silent on this. This should be a breaking news story. This should be what the news is talking about more than anything else. This should be the breaking news headline on every TV station, on every political website. This should be the main story. I was able to dig it up on ABC News, but it wasn't because it was the headliner story, okay? I actually had to dig deep to find it. But it is there, and I'm going to pull it up for you guys. It says 94% of COVID-19 deaths in the U.S. had underlying conditions, CDC says. And I'll read this to you. The U.S. Centers for Disease Control and Prevention has released information showing how many people who died from COVID-19 as of last week had underlying health conditions and contributing causes. And this is a quote from the CDC. For 6% of the deaths, COVID-19 was the only cause mentioned. For deaths with conditions or causes in addition to COVID-19, on average, there were 2.6 additional conditions or cases per death. It goes on to say, according to the CDC, some of the most common underlying conditions and contributing causes linked with COVID-19 were influenza, pneumonia, adult respiratory distress syndrome, respiratory failure, hypertensive disease, cardiac arrest, heart failure, sepsis, diabetes, vascular and unspecified dementia, renal failure, and intentional and unintentional injury, poisoning, and other adverse events. All right, there's one. Here's another article. I will put the link in the description to these articles that I used today. You can go and check the entire things out. This next article is from Outkick, which those of you that are sports fans, you may have heard of it before. It is a sports website. Many people that are sick of ESPN and fed up with ESPN, ABC, Disney, they're going to Outkick to get their sports news. And Clay Travis and Jason Whitlock are doing a great job over there from what I have seen. And Clay Travis did a really good job on this article. Just 6% of COVID deaths occurred without comorbidities. And again, we see that quote from the CDC about only 6% of the deaths. They were the only cause mentioned. And this is something that we have been talking about for quite a while now. That is the difference between dying with COVID and dying from COVID. Now, as Clay Travis says, to be fair, not all, maybe some of the deaths, the other deaths, some of the 94%, COVID may have had a role in it, and maybe they wouldn't have died if it weren't for the COVID. But they didn't die specifically from that, and there's a huge difference there. And if you're going by 94%, and that is really what it is, there's only been 6% that specifically died from COVID. That would put us at about 9,000 to 10,000 deaths. And I'm not trying to discount that, okay? The virus is real. For those of you out there that are saying, oh, COVID's a hoax and stuff, it is not a hoax, okay? I'm telling you right now, it is a real thing. People have struggled with it, and people have died from it, okay? This is a real thing. This isn't something that is made up, but there is overhype involved, and this is something we've been saying for quite a while now. Only 10,000 deaths. And if you want to divide that up by 50 states in the United States, considering that a good bulk of them are in New York and California, so if you don't live in New York and California, most of the other states, then you divide up by county, you're pretty much come to the conclusion that hardly anyone, there will be a few areas here and there, but for the most part, there's not going to be a ton of deaths that you see that often in your area. You look at the death numbers, you look at the case numbers, you're like, oh man, we're spiking. No, they're not all legitimate. The only COVID deaths that are seriously legitimate, and the death rate is still down compared to where it was back in March and April. The death rate is still down, and some of those deaths are not legitimate when you're talking about COVID-19. And again, Clay Travis did a really good job here, and I'm going to come back to a tweet that he put in the article. I'm going to get back to that because there's a really good point in there. But going down to the article, through the article, it says, it's well past time for everyone to be back at work, school, and playing sports on all levels from Little League to pro sports. And if you don't want to do that because the media has terrified you, that is your choice. You can stay in your house, buried under the covers forever. But the rest of us need to get on with our lives. You can't hold us hostage any longer. That was a wonderful quote by Clay Travis, and it was excellent. He hit the nail right on the head there. He goes on to say, unfortunately, this isn't happening because COVID is now the entire basis for Joe Biden's presidential campaign, which we will get into in a few minutes. And meaning instead of these facts being debated and discussed in a rational manner, Biden has tied his entire campaign to stoking more fear based on the false idea that we're all in tremendous danger from the coronavirus. Who says he wants to shut the country down? Which he said we need to listen to medical experts, but even Dr. Fauci said that we should not shut down again. So, there's something a little bit missing there, okay? Now, you can say whatever you want about Biden, but I don't want to make this super political. But it coming down to the point, okay, 2.6 average additional conditions or causes from which are linked to the COVID deaths. Okay, my grandpa is a good example. It was in his mid-80s. He ended up passing away this past July. We were told back in February he could go at any time, okay? He was not going to live much longer. Now, he was able to make it a couple months. We thought he was going to go several times, and he stayed alive. And in the nursing home he was in, they do weekly testing. They get tested once a week, and it was just a couple days before he passed away. They ended up testing him. At the time, he was not eating, he was not drinking. We knew it was going to be the next couple days he was going to pass away. They ended up testing him while he ended up testing positive. He ends up counting as a COVID death. He did not die from COVID. He was in his mid-80s, he had diabetes, and he had Parkinson's disease. He did not die from COVID. He was pretty much asymptomatic from the COVID standpoint of it, and he wasn't eating or drinking when they tested him, okay? We knew he was going to go in the next few days, and I'm sure that's not the only case of it. I'm not saying all of these 94% don't have anything to do with COVID, but the vast majority don't, okay? They really don't, and they should not be counted as COVID deaths because that wasn't the cause of it. And this is the next thing I want to get into, because we talk a lot about, the shutdowns, whether you're pro-shutdown, anti-shutdown, pro-mask, anti-mask, we'll get into all that. But Ethical Skeptic, he put out a tweet here, and this is a really good graph. This is from the US CDC excess fatality breakout estimate through week 33. And I'm going to try to zoom in here, try to expand this on my screen. And COVID-19, a projected amount of life years lost through COVID is 0.95 million. So almost 1 million life years have been lost, approximately, due to COVID-19. And you see the charts there and stuff at the current time and what the thoughts of what were died of and died with the virus, the differences and stuff. But the thing I want you to get here is it says the COVID-19 reaction, the hype, the shutdown, the mask wearing, the isolation, the social distancing, all of that has caused 1.44 million life years lost. If you're not aware of it, suicides are super, super high right now. Super high. Alcohol addiction is super, super high right now. Drug addiction is high. Okay, so first of all, the CDC, who has been very inconsistent in their guidelines through the entire thing, they originally come out and say, no, don't wear a mask, they don't work. Then a month or two later, they say you do need to wear a mask. Well, one thing that they won't tell you is that your oxygen level does go down. I'm not saying, don't get me wrong, I'm not saying masks aren't effective in keeping you from getting somebody else's germs. I believe that it does help you, protect you to an extent. But the virus in some masks, the pockets in the mask are bigger than the virus. The virus is smaller enough to where it could still go through. Plus, your oxygen level can go down to as low as 60%. And you do need good oxygen flow to your brain, or else you can get brain damage. I'm not saying these are things you need to worry about unless you're wearing a mask, 24/7, okay? I'm not saying that, and I'm not a medical expert. But your oxygen level does go down to as low as 60%, which is not healthy. Isolation is another thing. So we've seen, the hype, the mask wearing. There have been a couple people that I've heard from that have gotten lung issues because of wearing the mask. The lack of oxygen, I don't know what long-term effects this will have of people, that if they continue to wear masks, will we see people have permanent brain damage? We'll figure that out. But that's the interesting thing. More life years have been lost to the overreaction. And Clay Travis talks about it some in his article on how younger people, we're shutting down stuff to protect the older people, protecting the people with underlying health conditions. And if you're out there, if you're elderly, and if you have underlying health conditions, I understand why you should be fearful of this, okay? I understand that you need to be careful, okay? Totally understand that. Don't have a problem with it at all. But it's also hurting people in that some younger people, they don't know where to turn during this time. Okay, older teens, young adults, that they're not in school, not in college, they weren't working their jobs, they're not around people. Okay, we were not meant to be isolated from society. Okay, if you're by yourself and you don't know where else to turn, you're going to get depressed. Okay, that's why suicides are up. That is why alcohol addiction is up. Okay, well, what do I have to lose? I got nothing to do if you're depressed and people decide to try drugs. All of these things are up and are killing people, but yet the media doesn't talk a whole lot about that. They talk about, we got to save lives. That's another interesting thing. You notice how back at the beginning of this, the reason for the shutdown was not to overwhelm the healthcare system, which we did not overwhelm the healthcare system. Then once they figured out that, that wasn't going to be overwhelmed, you got to stay home to save lives. And don't get me wrong, I'm all for saving lives. But as we've seen, it is almost inclusively to the elderly and those with underlying health conditions that COVID is causing the biggest problems with. And, that graph really does hit home because, the 2.6 additional, on average, additional conditions or causes. Okay, COVID is not a reason for all of these deaths. And with all the shutdown and everything, that's causing more of a problem through depression and causing addiction, suicides. That's causing just as big or bigger of a problem than the actual virus is. And back done by a CDC study back in 2018, 2019, I know people don't like comparing COVID to the flu, like, oh man, it's so different. Well, there were 34,000 people that died from the flu. Again, many of these people could have had underlying health conditions, and many of those people may have been elderly and stuff, so obviously there's not, but there's still people dying from the flu. Of course, the historically bad year was 2017, 2018, when 80,000 people died from the flu, but that doesn't happen every year. But even if you're looking at 34,000, okay, we have to keep this in perspective. Okay, this has gotten way out of hand. So the message really at the end of the day is, it's time to reopen things, okay? It's time to open stuff. It's time to get back to life, okay? It's time to unmask the states. I think of, all the states that are still requiring mask wearing. Okay, that should end today. That should have ended yesterday. The day before that. Okay, we should not be forced to wear masks anymore. It's time to end the mask wearing, and all businesses should be allowed to reopen now. There's no reason for the shutdown any longer. Again, 10,000 deaths. That's not... I know that's not something to sneeze at, but seriously, if you divide it up, the states, counties, and again, California and New York have had it worse, but still, even including them, 10,000 in the entire United States. Many more people are dying from cancer and so many other issues. Drunk driving, I mean, there's so many other things people are dying from that we can't just shut down because of this, okay? It's time to end the shutdown, and no matter where you live, it's time to get back to life. And I said I was going to get into a football side of this, which I will get into in a minute, but the last thing I want to get into is more of the reasoning for this. And again, I don't want to get super political, but according to the National Pulse, a top Democratic data analytics firm has confirmed National Pulse exclusive reporting claiming it believes President Trump will win on election night, but in the following days, mail-in ballots will trickle in to reverse the victory in favor of Biden. And there's a man who did an interview with National Pulse. Again, I'll put that link in the description so you can check that out. here is the quote that the man said. He said, on the day he'll win the vote. My worry, and you just touched on it, is this early mail-in voting. I've seen postal voting, the British equivalent of this, abused wholesale. The United Kingdom to the advantage of the left. The worst scenario of all is on the morning of the 4th of November, Trump looks like the winner, and then over the course of the next 10 days, all these mail-in votes are counted, and the result gets reversed. And he also highlighted that the Clintons, Podestas, the mainstream mainstays, and the mainstream media, their counterparts, they are conspiring to reject the election results no matter what, and throw this country into a kind of chaos, quote, that will make Portland look like a playpen. And you all know what's going on in Portland right now. And it goes on to say that Team Clinton is fighting a grudge match against Donald Trump, and they intend to assault the traditions of this nation to do so. Antifa and their allies are closely on hand to help them, and no wonder they want police neutered and defunded so quickly. They want lawlessness. They want carnage. He also goes on to say that they'll claim victimhood status. They have to go to Congress the day after and protest whatever. They'll claim every victimhood status under the sun, and they'll lie, cheat, and steal to drag a process beyond Inauguration Day. We'll only see what happens. I don't know what's going to happen with all this. Only time will tell. Only God knows. But wow. And there are many other reasons for this. But, this is one of the reasons. And House Democrats, I will let you know, House Democrats, before the pandemic, back in January, they actually proposed a bill then for the encouragement of mail-in voting. They want to, try to get a process started of mail-in voting. So they started this before the pandemic. Now they're saying, well, because it's not safe to go to the polls. Well, they actually introduced a bill to the House Democrats, introduced a bill before the pandemic about mail-in voting. So think about that. Now I want to get into the football side of it, okay? What does this mean for football? Okay, I'm going to bring up a tweet from President Donald Trump that he mentioned about how it's time to get college football back. He says that he said that he had a very good talk with Kevin Warren, the commissioner of the Big Ten, who, by the way, I don't think is going to make it out of this. He's been so back and forth. Of course, the Big Ten has looked like a mess in all of this. They have no clue what they are doing. Sounds like they're going to be coming back now. And the president seems to think that they are very close to being able to get back going. He says that they are, quote, on the 1 yard line. And he says that it'd be good for the economy. It's going to be good for people. It's going to be good for the country, okay, to get football back. Big Ten football, of course, here in the Midwest. It would be excellent to have Big Ten football back, even though Michigan isn't good. I know Nebraska's thinking of, I think that one time they were thinking of suing the Big Ten. Ohio State, of course, quarterback Justin Fields was the one who started the petition, got over 200,000 signatures to bring Big Ten back. And now I can understand Ohio State's standpoint of view. I mean, Michigan, I think will be okay, but not excellent this year. Ohio State, they were my pick for the national championship before the Big Ten canceled their season. So we'll see what happens, but they're talking about October possibly coming back. That's what I'm hearing right now. If not, possibly Thanksgiving. That would be a little bit late. I don't think that would work out too well. But if they can get started in the middle of October, maybe they can still get something worked out. But I totally understand Ohio State. I mean, they're one of the top teams in the nation this year. So I totally understand them. That's rare. A Michigan fan actually understanding a Buckeye fan. That's, the pandemic's done weird things, okay? That's just one of them. But, okay, when I say it's time to get back to work, it's, okay, NFL players, it's time to get back to work, you too as well. Now, I understand some of these players that opted out, they had good reasons, okay? They had an underlying health condition, or their wife was expecting a child. They're expecting a child, and they don't want to bring it home to the family and stuff. I totally understand that and stuff. But for the most part, those that, aren't in a situation like that, I know people keep talking about the close contact of football and stuff. It's close contact. But Malcolm Jenkins came out and says, well, it's not really, I don't really want to risk anything. Of course, him being one of the bigger voices of the Players Association, this was back over a month ago. It may have been at the end of June and stuff when we didn't know about all these not fake deaths, but that a lot of these COVID deaths were irrelevant. And he was pretty much coming out and saying, how, the NFL needs to do a better job of protecting us. Well, for one, football's a violent sport, which I know that's totally different than COVID, but you're already putting yourself out on the line. And two, we've seen outbreaks in MLB, and they've seemed to move on from that. But even when the outbreaks happened, most of them seemed pretty asymptomatic. Nobody died from it, and nobody really seemed to have any real serious conditions from it that we know of. And the NFL, I get that it's, a close contact sport. But if the money that you are getting paid, especially the higher end players, if something were to happen to you, you have more resources than anyone else to be able to get the medical treatment that you would need. So you really don't need to worry a whole lot about that. You're getting paid millions of bucks to play a game. It is a big part of the economy. I understand that, and that's one reason why I think we need to get it going. But it's safe, and not only safe to bring football back, but it is safe to have fans in there. Now, the NFL needs to quit their mandatory mask if you get in there, but I'll take whatever I can get. If it's okay to have fans in there, okay, we can social distance, okay, but we can still get 25% capacity. Nobody's sitting on this side of a person, nobody's sitting on that side, nobody's sitting right in front, nobody's sitting right behind. Okay, if that isn't quite 6 feet, okay, if you can't get 25% capacity, do 15%. Okay, but in football, there is more. The fans play more of a role in football than in any other sport. So I believe it is crucial that they get at least some fans in there. Now, they're already announcing no fans for the first couple games, but they need to get fans in there. It's not as dangerous as people are saying. They can put in, whether that means dismissing by section, having different protocols in place. They already required masks, which I guess at the end of the day, it's not a huge deal. If I don't like the mask wearing, I don't have to go to the game. I'm not being forced to go to the game, and neither is anyone else. But I believe there would be some people that would be willing to do that and go to the game. And if that is the case, let's get some fans back in there at least, because there's really no need to do anything otherwise. That was just something on my mind, okay? It's time to get football going. People that are saying, well, it's not safe to get football, like Max Kellerman, or Dan Batard, and we talked about those in my ESPN ratings video and stuff. Most woke people on the planet, in the sports planet anyways. It is as safe as it's going to be, okay? People are way overreacting to this, and we see it by the amount that only 6% of these COVID deaths were specifically because of COVID. 9 to 10,000. That we shut down our economy, we ruined our record-breaking economy, all of these things that happened. And even in children, and people saying that we need to keep the schools closed. Well, we're also seeing that COVID doesn't have as much effects on children. The flu has more effects on children than COVID does. It doesn't get spread near as easily from what we have seen so far. So again, I'm going to put the links in the description. The Officer Tatum is another one. He did an excellent video on the same topic. He does an excellent job on his video, so go check out his channel. I'm going to put the link of that video in the description. You can go and check him out. Also, the links to the National Pulse, Outkick, the articles that you saw in the video. I'll put the links in the description so you can check the full things out for yourself. But think while it's still legal. Think while it's still legal. Don't lose your mind, okay? We got to get common sense back, okay? So that's what I wanted to talk to you about today and stuff. It is time to get back to normal. Only 9 to 10,000 legitimate COVID deaths. It's not what the media is telling you. The media has been silent on it. And we'll see if YouTube takes this down. I know YouTube censors things sometimes. We'll see if they take it down. I don't think that I really have enough viewers for them to really care if I make a video on this or not. So I don't really know if they're actually going to take it down, and I doubt they really care about my 40 viewers or whatever there is. I don't think they're going to really worry. But be sure to like, share, and subscribe. If you share this video, I don't have a huge voice. But if YouTube takes this down, you make your own video. If you see this taken down, you come back to the video and it's taken down, you make your own video. I encourage you to share this video on social media. You may have a bigger voice than I do. I don't have a huge voice, but one of you out there watching may. So I encourage you to use this, expose the truth. It is time for this thing to be done with, okay? We got to end this, all right? So be sure to like, share, and subscribe. Thank you all for watching. Again, I hope, I don't mean any ill will towards anyone that thinks anyone differently. But, okay, these are the stats. 6%. Okay, 6%. Okay, that's not nothing, but it's time to get back to normal. Time to have football in the fall as well. Thank you all for watching. You have a good one.